A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
You are tuned in to VOB 92.9 FM. It's 9 o'clock, and I shouldn't have to tell you because by now you should know what happens every Saturday morning on VOB. 15 eye-opening vascular minutes with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Hi Larry, good morning, and a euphoric good morning to everyone who's listening to VOB right now, especially if you are diabetic or pre-diabetic. You know who has your back? The Maria Holder Diabetes Center. That's who. They not only have your back, but they also have your feet because they have podiatry services available there just for you. They also have your belly too because they have dietitian Victoria Cox who can design a meal plan especially for you so you will not be eating the wrong things at the wrong times and setting off your blood sugar. Call 243-3937 to see Victoria for a personalized eating plan. They also have your eyes covered as the Maria Holder Diabetes Center located in Warren St. Michael does eye screening Monday to Friday for diabetic retinopathy.
What's that, boy?
That condition that makes diabetics go blind if it goes untreated. Here's what Dr. Charles Pierce has to say about this screening program.
We've started a screening program and we're trying to emphasize again that people need to come and have annual checks to see if there are any changes related to diabetes in their eyes, and we're trying to pick those changes up before they cause problems. So before you start noticing any change in your vision or any other problems with your eyes, we can pick up these diabetic changes and act on it, whether that's going to need treatment, referral, or closer monitoring. Everyone over the age of 12 with a diagnosis of diabetes should be having screening checks at least every year. If there are problems found, then we might need to see you more often than every year.
You hear the doctor? Everyone over the age of 12 who is diabetic should have their eyes screened for what? Diabetic retinopathy every year. So you know what you gotta do. 243-3937. Call and make the appointment now here. Do I tell you? Now we have some big eye-opening news. It has been confirmed that the Barbados Diabetic Eye Screening Program will be at Eddie's Supermarket, Speightstown on the 10th and 24th of February.
The 10th of February? You realize that's next week Friday?
Yes, it is. For more information, we now go to Renee Griffith, retinal photographer.
This month we'll be going to Eddie's Supermarket, Speightstown, for our outreach program. Our dates will be Friday the 10th of February and Friday the 24th of February. The times will be 10 a.m. to 2 p.m. I do encourage persons to call in advance to book their appointment. The cost of the screening is $100, and BARB members, you're asked to walk with your BARB card to get your 10% discount. The reason why we're asking you to make an appointment is to minimize your waiting period so the process would move more efficiently.
So for all the people who live in Boscobel, Orange Hill, 6 Mins,
You only got 6 minutes, 6 minutes?
Crab Hill, St. Lucie, this is for you. The 10th and 14th of February this month. The 10th is next week Friday. Make sure you are at Eddie's Supermarket in Speightstown. Diabetics or pre-diabetics, get your eyes screened for diabetic retinopathy. Take advantage of this. BART members get 10% off. Good. We now move from eyes to another important topic. The vascular service, which is available at the Maria Holder Diabetes Center. You already know the importance of getting your eyes checked, but it is also important for you to stay on top of any bad circulation issues that you may have, also known as P.A.D, peripheral arterial disease. You find that in the limbs and extremities of at-risk persons. And that is why you should call 243-3937 to book a vascular service to make sure that you are all good. But don't take my word for it. Let us hear from a medical professional, vascular surgeon with QEH, Dr. Nina Yap, speaking on how P.A.D. is diagnosed, the importance of exercise, and how smoking impacts on you when you have P.A.D. This is Dr. Yap.
Peripheral arterial disease is treated first and mostly with lifestyle changes. And I neglected to mention one of the more important things to prevent or combat circulation problems is exercise. So let's say you have poor circulation. By frequent exercise, your body actually creates other channels in the thigh and the leg. So let's say the main waterfall has blockages. Exercising and moving your muscles, your body actually creates new channels or new river bays coming off and finds other routes to get your blood down to your foot. So maybe it was a bad analogy I used before, like the main highway is blocked, it creates side roads to get around the traffic jam. And that's why exercise is probably one of the most important fighters against peripheral arterial disease. Exercise is number one, or at least at the top. Smoking. Smoking will any treatment that you do for peripheral arterial disease will almost not work or will almost fail, certainly, if you smoke through your procedure or through your surgery. The toxins in cigarette smoke, as well as marijuana, and vaping, we don't know enough about vaping yet, how it affects the arteries, but it's not thought to be good, is what I'll say. But marijuana and tobacco both line the arteries with toxins that destroy it and make peripheral arterial disease that much worse. And I'm very upfront with smokers that if they come to the point where they basically need a surgery, I tell them that anything that we do has a high chance of failing if they smoke through this treatment. High blood pressure. Keeping your blood pressure as controlled as possible is absolutely important. That high blood pressure is literally the pressure within your arteries. And so the higher that pressure, the more trauma, the more force, and the more injury on the walls of your arteries. So the better controlled your blood pressure is, the better your blood likes it, the better your heart likes it. Everything just travels at a much more controlled, happier pace. It's not that high pressure forcing its way through, causing trauma to the arteries all the time. It's just a nice, cool sailing sort of situation. And diabetes. Diabetes is, I think, probably 99% of patients I've ever had to treat are diabetic, and uncontrolled diabetes or poorly controlled diabetes also directly injures the arteries in the body. And all diabetics probably listening in will know this, that it affects their eyes, it affects their kidneys, it affects their heart, and it affects their legs. So having good control of your diabetes is absolutely important. So I'd say exercise, high blood pressure, cholesterol as well, diabetes, and not smoking, or at least cutting down if you can, is so vitally important. So I'd say that those are the things to start with. The surgeries for peripheral arterial disease are really intricate and quite a lengthy, intense discussion, and it's a conversation I take very seriously with each patient that I think needs an operation. I'm a surgeon, and while I like to do surgery, I put so much more emphasis on the things to do before surgery, because that is where the ticket is. The ticket is trying to get things before they come to the point where you might need an intervention. To answer your question very briefly, what are the surgeries for peripheral arterial disease? There are two main types of surgery, that done by open surgery to try and clean out the arteries, or try to bypass the arteries, which is literally like trying to make a new road. So if the highway is blocked from point A to point B, you make a new road from point A that bypasses and makes a new point C. And the other way is through endovascular procedures, which is a small mini cut in the groin, and we send wires down inside the artery to try to open up the blockages with little balloons or sometimes stents if needed. But again, I tell almost every patient, if you come to surgery, once you start surgery on things, it's sort of a continuous thing. That will not probably be your only surgery for life. The most important thing is to try to get things right before you have to come to a surgeon or a surgical unit.
Thank you, Dr. Nina Yap. As we continue inside of 15 minutes with the compliments of the Maria Holder Diabetes Center, we now go to our song of the day. A song that's a reminder of whatever challenges you face as a diabetic, the Maria Holder Diabetes Center is there for you to help you get over your challenges. This is Imani and Biggie Irie teaming up from Cropover 2014 with the song Get Over.
You will get over. We're gonna help you get over. over, yeah. Even if you feel to tip over, we're gonna help you get over.
The Maria Holder Diabetes Center.
Hold on, just a minute. This is what we call life. Let nothing break your spirit. Keep your eyes on the light. Don't walk away where there is hope. You've got the chance. It can be rough sometimes. Put it behind and move on and on. With your heart, with your soul and mind. You're gonna see in time. Don't rush. Believe in yourself and just know that you're gonna make it. Come on, we're gonna win this. It's all part of life.
And just when you had enough, feel like giving up, hold on. Believe the good in life, you will survive. Be strong. You will get over.
The Maria Holder Diabetes Center.
We're gonna help you get over. Yeah. With that weight on your shoulder, still gonna get over. Whoa. Come together as one. Stand firm as a nation. Island under the sun. We are all Jah creation. Don't walk away where there is hope. We got the chance to make the change. It'll be tough sometimes.
Don't you give up now, you will find a way somehow to break through. And I know sometimes you feel to cry, but try your eyes and smile.
And just when you had enough, feel like giving up, hold
The Maria
on.
Holder Diabetes Center.
Good in life, you will survive. Be strong, and you will get over.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
Still gonna get over. Ah, yeah. Who come here to party? Who come here to lie? I know things might not be good with you, but leave those problems behind. Head nice, feeling fine, no stress, have a good time. Hand in the air, hand in the air.
It's time we heard from someone who has experienced the excellent services of the Diabetes Center firsthand, Mr. Henderson Brewster. Henderson, how long have you had diabetes?
31 years.
Tell us about your experience with the Maria Holder Diabetes Center.
To me, they're helpful. I ask a lot of questions and I get all the answers I want. It's like, I get information. I like to ask questions and I get information.
Did you find the staff receptive to all your questions?
Of course, yes. The doctor and the nurse.
And the advice you got from the Diabetes Center, did it help you to cope with your diabetes?
Of course, yes. And not only that, but they do lots of like blood work and stuff like that. And keep me on track. You know how the body function and keep me on track.
So will you recommend persons who are listening visit the Diabetes Center?
So far, what my information is best to do that.
The Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. So if you're a diabetic or pre-diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened by calling 243-3937 to make that appointment. In addition, there's now a new vascular service that is the centerpiece of a national campaign that will highlight the discovery of early circulatory problems in the limbs and extremities of at-risk persons. So if you are having vascular or circulation problems, call and make an appointment at 417-0305 or 243-3937. The last 15 minutes you heard on your radio was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Until next time, take care of your eyes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243 3937.